I've coached hundreds of nurses and nursing students, and when I'm coaching them and preparing them for an exam, something that I have observed is they are thinking that they have to know everything. And knowing everything can be overwhelming, and you don't even have to do that. Also, just knowing the material is not enough, because Canadian nursing simulations, assessments, and exam, it's not just about memorization. It's about how you apply this knowledge in your clinical judgment. How are you able to use critical thinking when you are making decisions in regards to patient safety? And that's why I created the CARE framework. This is something that you can use for your CBA and SLA preparation, for your NCLEX, and also once you are working here in Canada. The CARE framework is a system that you can use step by step for critical thinking in any clinical situations. The CARE framework stands for collect, analyze, reason, and evaluate. And we'll go over it one by one and how you can use this in your clinical practice. This framework is something that you can use in your daily practice as a nurse when you are preparing for your CBA, SLA, and NCLEX, and this will help you think clinically and critically like a Canadian nurse. Let's start with letter C, which stands for collect. Collect means gathering all information, all relevant data for your patient. So for collect, we are collecting subjective and objective data. So let's write it down. Subjective. So subjective, think about what is your patient telling you. Maybe they are complaining of pain, they are complaining of shortness of breath, they are complaining of headache, they couldn't sleep properly last night. That is something that you are collecting, because that will be relevant when it comes to your patient's care plan. So let's say pain, patients complain of, let's say, shortness of breath, can't sleep properly. Subjective, what is the patient telling you? Next would be objective. And for your objective assessment, these are things that you have collected and gathered. So for example, your assessment findings, when you have done vital signs for your patient, when you are looking at patient's lab results, those are all objective information. Another thing that you can add for collecting, gathering information would be patient's history. Also, social status. So for example, social status, does the patient have family involvement in terms of their shelter, right? In terms of their employment status, and how that affects the patient's safety or the patient's healing process. And for patient's history, think about comorbidities, right? When you are also collecting blood sugar for your patient, any subjective and objective information, then you'll do that in the very beginning, because that will affect how you are going to be starting thinking about the patient's intervention. For this section, I want you to ask yourself, what else do I need to know? And when you are collecting and gathering information, I don't want you to just collect and gather obvious information. I want you to think about the big picture. Because here in Canada, Canadian nurses are expected to do a full assessment, a comprehensive assessment that also looks at the patient holistically. If you don't know where to start and you need more help and guidance with comprehensive assessments and holistic picture of your patient, I created a free guide and workbook that you can download right now when you go to my website. It's called the 10 Steps to Prepare for Your CBA and SLA. And in this guide and workbook, I discuss what is Canadian nursing standard, what is expected during your CBA and SLA, how are you evaluated, how can you strengthen your clinical thinking, how can you start improving your clinical judgment. And I also included practice questions that you can use and you can start doing now in preparation for your CBA and SLA. And you can download that right now when you go to my website, nursingcollective.co. Also, you can check the link in the description and also in the comment section. Now let's go to the next section. Analyze means identifying patterns, and also figuring out what are your priorities. So when you're thinking about analyze, I want you to start thinking about your priority for your patient. So think about ABCs, your airway, your breathing, circulation. You can start thinking about Maslow's hierarchy of needs. And then start asking yourself, is this patient stable? Is this patient improving? Is this patient deteriorating? And based on that assessment, what do I need to do as the primary nurse? In this section, this is when you're analyzing all of the information you have gathered and you are asking yourself, what am I missing? What am I seeing here? What is the pattern? How can I take care of this patient in a systematic way? So let's write that down. And what am I seeing? During the analyze section, this is when beginner nurses start becoming expert nurses, because this is when you are connecting the dots. Based on the information you have gathered, you are now connecting the dots and figuring out what's the priority here. And this is how you can start thinking like a Canadian nurse. And this is how you will also be evaluated during your CBA and SLA. During your CBA and SLA, you have to demonstrate and sometimes even verbalize your clinical process, your critical thinking. And this is something that I focus on when I'm coaching nurses and international nurses preparing for the CBA and SLA. Because this section, the analyze, this is when you are figuring out what is your priority. Next is reason, and this is when you are connecting your clinical judgment, what you know about the patient's diagnosis, about the patient's status, and you are connecting that to your patient's assessment. So let's think about pathophysiology. In this section, so let's write pathophysiology of your patient. And this is when you are asking yourself, based on the patient's symptoms, the patient's signs, what am I seeing? How does that relate to the patient's diagnosis? Is this related to the patient's diagnosis? Is this patient deteriorating? Is this a complication am I seeing? You are also asking yourself in this section, what is the underlying cause of this patient's symptoms? This is when you are starting to think, why is this happening to the patient? So let's write it down. Why is this? So let's write it down. Why is this happening to the patient? And in this section of the care framework, this is also when you can call the physician. So when you are calling the physician, you're using S-bar. What are the information you're telling the doctor? What are your recommendations? What are your assessments based on what you saw? Also, in this section, this is also when you would document your clinical findings. You are documenting your assessment. You are documenting what have you discussed with the physician and the multidisciplinary team. So let's write it down. So S-bar and F-dar. In this section of the care framework, the reason portion, this is also when you're demonstrating that you're not just following orders, you understand why. And lastly, evaluate. Evaluate is very important, and this is something that they will test you on and evaluate you on your CBA and SLA as well. So for evaluate, this is when you are continuously monitoring the patient and you are evaluating all of your interventions. So let's write it down. And also in evaluate, this is when you are asking yourself, did my interventions work? Do I have to do something new? Do I have to do something else? So for example, maybe the patient is deteriorating. All of the interventions that you have provided before is not working because you've done your evaluation. So now maybe you have to do a different focus assessment, another type of focus assessment. Maybe also after you evaluate the patient's current status, you are also calling the doctor, you are updating the doctor, or maybe you're getting new orders, so you have to S-bar the doctor either for updates or maybe new orders, and collaboration with the team. And you're also collaborating. Don't forget that you also need to be collaborating every time with your patient. Involve them in their care. Not just the patient, but also family members, if there's family members involved. So you need to evaluate all of your interventions. So the key question for evaluate is, did my interventions work? Did my interventions work? With Canadian nursing, nurses are expected to continuously monitor the patient, evaluate all your interventions, and adapt as needed. This is why the care framework is so powerful if you know how to use it. The care framework will keep you organized, it will keep you thorough, it will keep you focused, and it meets the Canadian standards, which is evaluated during your CBA and your SLA assessments, but also most importantly, once you are working as a nurse here in Canada, as an RN, as an LPN, as a mental health nurse, and even as a care aide, you are also expected to meet Canadian standards and work within your scope of practice. And whether you're being observed and evaluated during your CBA and SLA or even NCLEX under high pressure, or you're working as a nurse here in Canada in a hospital, you're taking care of 4 patients in a very busy unit, the care framework is something you can use. So then you stay focused, you stay organized, you're able to do thorough, comprehensive assessments, you are able to think systematically, and you can provide safe patient care. This is the difference between passing and failing. This is the difference between confidence and feeling lost. Here's what I want you to do. I want you to start using the care framework, not tomorrow, today. Start using it today. Start using it when you're practicing case scenarios. Start using it when you're going over practice questions. And if you want to go deeper, I use this framework in 2 options. Option 1 is in my group coaching program, where we go over case scenarios and how to apply the care framework in different case studies. We go over it together in live time. You get real-time feedback, and you are supported by other international nurses who is studying and preparing the same time as you. Option 2 is in my self-paced prep course, where you can go over the framework on your own schedule and your own time through case scenarios, video lecture, video lessons, nursing skills, and so much more. Links to both are in the description below and in the comments, so choose whatever works for you. Here's what I know. You didn't come all this way to fail. You didn't give up your nursing career in your home country. You didn't leave your family and your friends to give up on your dreams. The care framework is your system. Master it, own it, use it, and watch how everything clicks into place. If you found this video helpful, please support the channel by liking, subscribing, and hitting the bell for future videos. Drop a comment below as well to share your thoughts, ask questions, or suggest any future topics. I would love to connect with you. See you in the next video.